NBT World, a vision of Thailand.
Now we are lacking of the dental specialists like oral and maxillofacial surgery who can taking care of the oral cancer like that, or even the orofacial pain who can treat like the temporomandibular diseases. And then so they are not expert, especially the oral cancer. Then when they have the patients like oral disease and then they don't know how to do it, they can send the information to the specialists in the tertiary hospital or even our faculty staff who are specialists in Chulalongkorn Dental School via our Teledentistry.
Swadika, welcome to Thailand today. In Thailand, access to quality dental care remains a challenge, especially in rural areas. But what if technology can bridge the gap? In this episode, we explore Thai Teledentistry, an innovative platform created by Chulalongkorn University's Faculty of Dentistry, which is reshaping the future of oral care. Stay tuned. Swadika. Thank you for joining us today. Could you please introduce yourself?
So my name is Thanaphum Orsanon. I currently serve as Associate Dean for Academic Affairs and Graduate Study at Faculty of Dentistry, Chulalongkorn University.
I am Narudi Ningpuangtip. I'm currently a faculty staff at Department of Prosthodontics, Faculty of Dentistry, Chulalongkorn University.
Right. So you're a co-founder. You two are co-founders of a very interesting project called Thai Teledentistry. Can you tell us what is it about?
So let's go back to the original thinking why we starting this project first.
Right.
First of all, the access of care, especially dental care, in population in Thailand is very low. Less than 10%, approximately 9%, which is come up to the way how to increase this access to the populations.
Right.
That's why we're thinking about to develop two main projects. The first one is called Teledentistry, which is the consultation system, the platform that professionals can consult other professionals. They can exchange their knowledge, idea, and treatment suggestions through the system. So it will help dentists in local area can have better ability to treat patients. That's the first project. The second project is about the teledentistry using the intraoral cameras. So this one we focus on a public service that can go using intraoral cameras and captures oral conditions of the patients in the rural area and send us pictures and consult with the local dentist. In this way, the patient that's out of reach of the hospital or in very rural area, difficult to commute to the hospital, they can have access of care if they need to. So that is the main true project that we develop in order to increase the number of accessibility of dental care.
Okay, previously we have Line. You can have Line and then you send the information via the chat. So the dentists working in local community, they send Line, the message and the images of the patients. So the problem is the data is very scattered and it's not stored. Like we concerned about the data privacy. So it comes to like developing the teleconsultation system that can be a professional tools that more store data properly, and we can have a long-term follow-up of the patients as well.
Right. And how do you find the network? Let's start from the one that used with the dentist, from dentist to dentist.
You mean the location that we implement as projects?
Right. How do you find? Yeah.
So we try to set up the area that like a sandbox, small area first. So what we think is the area that we have connections in that communities. So we think of the Nan province and also Siliguri province.
Nan in the north.
Nan, yes. Yeah. That is because Chulalongkorn University, we have what's so-called Center of Learning Network for the regions set up over there in Nan province and also in Siliguri province. So pretty much we know local communities. We have network with authorities, local government. So that's why we start with these two provinces as a sandbox first. So we can have communication easier and at least we can implement successfully in those two areas.
Right.
But besides those two sandbox, we also have other provinces as well that they know the project and they're interested too. So they negotiate with us and try to implement this one in the system as well. So maybe
But aren't local dentists are expert already? Why do they need to consult with the dentist again?
Actually, sometimes the local dentists are not the specialist, so we need a special training in order to become the specialist. Now we are lacking of the dental specialists like oral and maxillofacial surgery who can take care of the oral cancer like that, or even the orofacial pain who can treat like the temporomandibular diseases. And then so they are not expert, especially the oral cancer. Then when they have the patients like oral disease and then they don't know how to do it, they can send the information to the specialist in the tertiary hospital or even our faculty staff who are specialists in Chulalongkorn Dental School via our teledentistry.
Right. So this is just a consultation that you provide, right? Not a treatment. A
Yeah.
treatment that needs to be done locally
Yes.
in that hospital.
Yes,
right?
exactly.
And the dentists that consult with you, they're from local clinics or local hospitals, or both?
Right now they are mainly local hospital. We haven't collaborated with the private clinic yet. Now we work with the public hospital.
Right. What about the second group of users, the health volunteers
Yes.
and the ordinary people? How do you train them, and how is it implemented?
That one would be an intraoral camera. Usually we let the village health volunteer to become a training, like 3-day training for capture the images in the oral cavity. Usually the volunteer have the basic knowledge in healthcare and also oral healthcare as well. So they just train how to use the camera properly. And then when they go to like each house and each person, elderly person, so they can capture the image and send the information to the dentist in the tertiary hospital or secondary hospital.
Right.
So for this one, I would suggest one example. It's called SCAD model. It's in SCAD district in Nan province. The public health service in that community, they use intraoral cameras. And
It's like the camera with a small tip and then it can go into your mouth, like each of it.
Like very detailed
Very
camera.
detailed camera, but it's not expensive and can be used in community as well.
and very small, it's easy to carry into the communities. So that's why like health service volunteer can use that cameras and then capture the oral image of the people in their home or in their school, and then send that picture to dentist to consult whether this case would supposed to go to see dentist or is okay or it need to be other instruction to be care for that. But anyway, for the SCAD model, the health volunteer using intraoral cameras to capture, consult with dentist, and then send a patient to see dentist in hospital. Dentist have a treatment for those patients, and the patient go back to their communities. Again, public health service volunteer, they use intraoral camera to follow up again. So it's kind of complete the cycle of the loop of treatment. You proactively find the case to have the early preventions, and then you consult with the professional dentist. After finish, you have the follow up. So it's kind of like if you can do this as a regular process, it's going to be promote oral health in the better way.
Does it also in a way decrease cost of diagnosis and treatment as well as a whole?
I would say so. If you can detect it early, you do preventions instead of like really invasive treatment, that would be save the cost as well.
And why were these two provinces chosen as the pilot provinces?
Like I mentioned before, it's related to
To the center.
Center of the Learning Network of Chulalongkorn University, which
Right.
we have network to collaborate with local already. So they know us, so we can like easily implement it to the communities.
Right. When has this project been initiated? 3 years
2 years
ago. you
ago,
told-
yeah,
right,
like
you told me.
2022.
Right. And how has been the feedback so far? From the dentists first,
From the dentist first.
the local dentists. Have you talked to them?
Yeah. Actually, the local dentist can send the information usually when they have problem. Like sometimes like seems to be a very simple problem. Like how can I design the denture properly? So they just send the information, in our tele consultation. It's called Thai Teledentistry application.
Right.
And then they can send their patient oral cavity, even the images, or if they have the intraoral scanner, they can attach the file as well. And then we can plan together. How can we plan together? I can send the information back like typing, but if they still don't understand, we can make a video conference in our application as well. So it's I think it's very benefit for dentists, even the oral disease are not so severe, but they just have someone they want to consult.
Right.
So besides a good system, they also like have the, the security system as well. Besides using social network that they usually do for consultation normally with the list of PDPA or the leak of
It shouldn't be done this way.
information, something like that. So this system, this platform had very skilled situations, and then dentists local area they found it very secure, and they confidence to use the system.
Right.
Besides using those social network.
Right. What about the patients? Have you talked to them? How does it help them?
Actually, the patient wouldn't have a chance to use the teledentistry application, but the patients would have a chance to use the intraoral camera. Like when they take the oral images from the patients, instead of having them going to the hospital, they can just stay home and let the village health volunteer just taking intraoral photograph, and then they just stay home. If this is emergency, they will be sent to the hospital, but if they can take care of themselves, so that's fine. So I think it's very time saving and cost saving for the patients as well. Instead of waiting for the dentist, like coming to their house like once a week or even once a month.
Once a month?
Once a month. They can have
in a rural hospital.
Yeah,
I would say.
they can have promptly examination and then tackle the problem immediately.
You're working with inmates as well, right? Can you tell us about it?
For the inmates,
For the
right?
inmates.
In the prison, we have like the prisoner health volunteer, and in the prison we don't have the dentist anymore, even anywhere in this country, in Thailand here. So what we can do now is like in the prison we don't have Wi-Fi, we don't have dentists, we don't have doctor, but when they have oral problem like swelling on their cheek or even have a tooth pain. So we have prisoner health volunteer. The prisoner health volunteer, they are like good time allowance prisoner who are selected, and then they just use the intraoral camera to capture the area that they have the problem, and then they can store the data in their computer. After that, the nurse will bring this information and send to the hospital in that area to diagnosis, and then the dentist can prepare their materials, their instrument, and come to have a treatment advance.
So the inmates is very, I would say, underserved populations. They have lack of care. Even though they have problems, they might notice that they have problems. They will notice when they have very painful situations or very exacerbated situations already. So if we implement this intraoral camera project into the prison, it would help them to detect early. Then for the case that need to be done, they can have that access to the care early.
Right. And how do you plan to expand this project to develop more?
Yeah. Generally, right now we have the platform and we already implemented in the sandbox already. So next step is we try to implement it more wider. Like now we have like 3 to 4 provinces that using this system already. We try to expand that whole country could be use this system as well. We provide for free anyway, so everyone can use it. So hopefully that in the future, if we can expand the usage, that would be help dentists in the local area as well.
And actually, we're planning to move it onto like learning hub center for every dentist. Like based on the real cases, every dentist can share their knowledge and experience, and then like the national learning hub. And it's not just only for the national level. We plan for have a collaboration in the international level as well.
Thailand, a land of success and reward.
Reward your team with an extraordinary journey that celebrates their dedication and achievements. Immerse yourself in breathtaking natural landscapes. Indulge in the soothing touch of traditional Thai massages. Savor the diverse flavors of Thai cuisine and experience the charm of a culture rich in heritage. Give more than just relaxation. Give lasting inspiration. This incentive travel journey is more than just a reward. It's an opportunity to strengthen team bonds, ignite inspiration, and create lasting memories. Discover Thailand, your ideal MICE destination. Inspire your team today. Thailand's strategic vision positions MICE as a national growth engine. Through the Thailand Convention and Exhibition Bureau or TCEP, the government implements a 5-year master plan to elevate the MICE industry. This includes digital transformation, green standards, and enhanced regional connectivity through smart MICE cities across the country. With streamlined public-private partnerships and one ministry, one convention policy, Thailand aims to attract world-class events and generate inclusive economic growth. The goal is clear: to welcome over 34 million MICE travelers by 2025 and reaffirm Thailand as Asia's MICE powerhouse. Thailand is rapidly transforming into a smart MICE innovation hub, where technology, infrastructure, and policy converge to support business events of the future. The country offers seamless digital solutions for planners and delegates alike. The Thailand Convention and Exhibition Bureau or TCEP leads with a one-stop MICE service platform, and streamlined MICE lanes at major airports ensure swift arrivals. Thailand provides not just convenience, but sustainable innovation at every step. This is where digital advancement meets global business vision. This is Thailand.
Can you share a success story or like a very meaningful case to you using this?
I would suggest
I would say it becomes in the prison because usually, especially during COVID-19 situation, the dentist or anybody cannot go into the prison, and then there's a lot of problem there. So at that time, usually the number of the prisoner who receive the treatment is going to be declined like this. But after we have a proper screening and initial diagnosis properly, so when they comes to the treatment, it's faster, it's more comfortable. So we increase the number of the prisoner who receive treatment back to the normal level and even higher and higher.
Right. Yes. Is it challenging to use digitalization in dentistry, especially in the remote areas, or a specific group of people, for example, the elderly? Do they understand?
Actually, I would say that the patient doesn't have to understand. Yeah. Just we train the dentist and.
But are they open-minded to?
I would say yes.
Yeah. I think they are. They feel exciting. Or when I take the camera and take their photo, it's like, oh wow, that is my teeth or something like that.
So the patient do not have to have literacies on the digital, but the local volunteer dentist, they need to. But anyway, they are very excited, like she mentions. They're eager to learn, and the technology is not quite difficult for now. It's very fairly using the machine as well. But if we're talking about the platform to implement, there might be some area that be difficult. For example, in person. That have limited access to the internet. So that we have to modify the system a little bit, not just only to use online, but we have to use online and offline in different situations. So that going to be on that way beside the digital literacy of the user.
And what kind of impact has this platform had on the underserved group especially?
I would say that the increased number of the patient who can access to care, and not just only increasing number of access to care, but also we can detect early for the lesions or for the problem the patient has. So that treatment for the early lesions would be very less cost. So it's cost effective more than just waiting to have exacerbated situations and have treatment later.
Instead of having everyone going to the dentist and wait for a very long time, like 3 or 5 hours. So I think we save a lot of time on this one because we can provide like initial diagnosis or like can have a prompt treatment, and sometimes like they can take care of themselves during this time what they have to do during waiting for the dentist. And then this is cost saving for both patient and the hospital.
And where do you get your funding from?
So we are lucky to get the support from Broadcasting and Telecommunications Research and Development Fund for Public Interest that we offer by Office of National Broadcasting and Telecommunications. So we got a lot of money to develop this one, and I think it's very successful in terms of like giving benefit to the communities and also public as a whole.
Right. Do you plan to expand nationwide except at the centers of Chulalongkorn University?
Yeah, we do. Not just only the 3 provinces that we already start, we try to expand more, try to implement to the all province in Thailand. That's the first step. Next step, we try to connect, as a platform, we also have the English language as well. We try to connect this one with other countries in terms of expert to come to help, and also if the other country would like to use this one as consultation system in the closely security system, that can be in that as well.
Right. Some people say that in Thailand, good dental treatment is for the rich. As a dentist, what do you think about that?
First of all, I would say that the equipment, the materials to use in dental treatment, most of them, I would say 99% is import from other countries. We have very limited source that can produce dental materials or instruments in Thailand locally. We do have some, but not that much. So with the import system, that's why the cost of treatment is very high. But in the other way, I would say the governments try to support the care for dental very much. I would say, for example,
Like the national health insurance, the oral health insurance. Sometimes not sometimes, actually we have like free insurance, like for civil servant, for national health insurance, for free of treatment in some treatment. But for my experience, sometimes the patient themselves don't realize that they have a problem until the problem become more severe. And sometimes they don't have time to come to the hospital, especially those who like have limited income. So they have to go out to work rather than waiting for a very long time in the hospital.
Right.
So I think there are several limitations, not only giving the insurance for free, but have to support their life as well.
When I was a teenager, I tried to get braces. And then I contacted the government clinic, government hospital, and they told me that I needed to wait a year. Why so? Is there a problem in dentist to population ratio in Thailand?
I would say in the past, yes.
Yeah.
The ratio of dentist to population is really low in the past, but I think it's getting better right now. Approximately now it's about 1 to 3 to 4,000, one dentist per like 3 to 4,000 populations. But anyway, even though we get a good number of the dentist to population ratio, but we still have a lot of problem with the distributions of the dentists. Most of dentists, they stay in the cities, or even though they go to serve in the public hospital in the rural area, they can stay only for quite some time, but not that long. They have to leave out the system anyway. So that problem is ongoing. So we have to thinking about the whole system, how to retain the dentists in the system. In the same time, we produce more to adding the number into the system as well.
What do you mean by leaving the system? Like, how does the system work for dentists in Thailand?
For me, I would say the system means the dentists after 6 years, they have to work in public hospital for like 3 years. During that time, I would say that hospital or where they go to are not their home as well. So the dentists also would like to go back to their home. If they cannot go back or move to the hospital nearby their hometown, I would say, they will leave the public hospital and working in private practice instead, most of them.
Right.
I think most of the faculty of dentistry in Thailand, they try to address this problem. For example, in Chulalongkorn University, we have the admission track that's specifically for some regions or some province or district that lack of dentists, and we have the quota for the student in that area. Once they come to study with us and they graduate, they have to go back to their hometown. And in this way, we get the people from the regions for the local area that specifically need dentists. After they graduate, they go back to their hometown. So they would like to stay more in their hometown city. That would be help a little bit in terms of like retentions, the dentists in the area that need it.
Right.
But I would say that is very small amount compared with the all area.
Is it hard to be a dentist in Thailand?
Uh,
To study?
To
Is
study,
it
during
hard?
study or
How many years you have to study?
like
to
we have
be
6
be a
years for
dentist?
the undergrad students, and we
Right.
have like clinical training maybe for 3 years, or even if you have to be the PhD student, it would be 5 years. So totaling, it would take like 9 to 12 years. But during that time, we have a gap for them to like practicing in public or even private hospital, and to make them like decided which kind of specialists they want to go to. Or even they can be general dentists, they can practice as well, but just in some special area like orthodontics, they have to apply for formal education.
Right. You told me before that we lack specialists, right? Dental specialists in Thailand. Can you elaborate?
So right now, let's say we have approximately 20,000 dentists for the whole country,
Right.
and among that 20,
For the whole country?
yes, among that 20,000 something, we have about 10% that are specialists. So meaning that we have about 2,000 dentists that actually certify as specialists. When compared to population and distribution is really lack or very insufficient to serve all the 70 million people in Thailand.
Right. When I'm talking to you, I see that you're very passionate about your job. What do you like about being a dentist?
Let me start with you first.
What do you like?
Yeah.
I like giving a big smile to the patients. It's
Yeah.
like I am prosthodontist, so when I do the prosthesis, I call it denture for the patients, and they can smile and they said like, I have never eat this one for more than 10 years, and they say, oh, I can eat it with your denture. Thank you so much. That is very heartfelt.
Right.
So most of the dental patients, they're not, it's not life-threatening. But when patients come to see us, it's more like want to be more confident, or they have some pain that cannot be tolerated. So it's not, even though it's not life-threatening, but it's so after we treat them, they improve the quality of life.
Right.
They can eat more, they can smile more, they can confident in go to social.
But I would
with
say
people.
the oral health is really linked to general health. Once you told your patients to like eat less sugar, don't eat like vegetables, you have to realize that they don't have teeth to chew the vegetables. So that's why
It's very sensitive.
Yeah. This is what I have talked to the doctor in our faculty of medicine, that if they cannot have their teeth, how can they chew the vegetables or eat the fruits or kind of fiber food, something like that. So they need to have the teeth.
Right. And do they have better understanding with oral health in general in younger generation?
In younger generation, I think they have a more educated, and we have like social media platform to get access to. But for the elderly, for Thai, I would say sometimes they are like, oh, I'm gonna die soon, so I don't want to do anything. And sometimes they come to the dentist just because of their daughter or their sons.
But overall, I would say that oral health literacy is getting better in the younger generation.
That's good.
Yeah, because from the national data, the number of totally edentulous patients are decreasing, and like, so that's a good sign.
All right. Thank you again for sharing with us your great project and your experience. ขอบคุณค่ะ